I must admit that I was a little bit intrigued reading the question about GABA as an effective ingredient in over-the-counter sleep aids. Barry, can you give us some perspective on the question? Maybe Barry is not back. But any of the pharmacists?
I'm back. I just unmuted. Yeah.
Oh, I'm sorry.
Yeah.
Great.
So we know GABA is a sleep initiator, you know, in the brain, and but you know, I've as I mosey around, you know, some of the CVS and other pharmacies, just kind of picking up some of the over-counter medications and looking at the what they call the active ingredients. You know, many of them will put GABA in as an active ingredient. And I was just wondering, you know, does it translate from, you know, what GABA does in the brain organically to, you know, what we're putting in these over the counters? And I think Dr. Kozlowski mentioned valerian root and, you know, some of the other, what they call active ingredients. And, you know, are they effective, or is it just a, or is it just a marketing kind of ingredient and something that's promoted to patients that have no idea what these things are?
Sure. Dr. Kozlowski, do you want to, or, you know, anybody just want to just jump in on that one?
Yeah, the short answer is no. The GABA doesn't cross the blood-brain barrier when it's taken orally.
Yeah. Okay.
So it's, you know, taking it orally is not going to be effective. There's some studies that say that taking it with L-arginine can boost the amount that crosses because it's very small, but pretty much it's a marketing ploy.
Oh.
A lot of times too with the herbal supplements, just going back to that too, the active ingredient, the amount of active ingredient usually is so small that you really question how much the patient is receiving. And a lot of times, you know, the studies are very limited as well. And so it's a matter of just doing a lot of research, but just, I think anecdotally going back to the fact that there is that strong placebo effect. And if the patient is empowered or has a, you know, desire or belief that it's going to help them, then a lot of times that tends to also play a large role in whether or not a treatment is successful or not.
Let me piggyback this on what Dr. Lown said earlier about adenosine, because, you know, my understanding is adenosine is really the driver of sleep, and, you know, caffeine being you know, affecting adenosine receptors. And, you know, is there any research around that? Is this something up and coming? Is this, you know, is there any place where over the counters are developed in that area?
I haven't seen anything. So,
but the problem, Barry, is that it's the reason why you produce adenosine is because from glial cells. So glial cells obviously are providing energy to neurons, and by creating ATP, you turn over ATP to adenosine. It's mostly in the basal forebrain that's being studied. The weird part about that, and we know that adenosine is definitely the inducer, like you said. The weird part is actually when you've done ablative studies of the basal forebrain, it actually doesn't have an effect on sleep in experimental animals, which is weird. In other words, if you get rid of the sensing area, it doesn't affect adenosine. Adenosine still works. The other thing is there's been experiments with adenosine being injected into the CSF, and it actually does induce sleep. The problem getting that, you know, like a significant amount concentration in the basal forebrain for it to be effective. I was bringing it up before because, like I said, you know, obviously caffeine's a non-specific adenosine blocker. And the problem really as we get older is it's not adenosine levels. Adenosine levels are actually higher as we get older. We get sleep fragmentation because the receptor for adenosine theoretically is less. There's less receptors. So we're less responsive as we get older. But I don't think there's any you know, anything in the short run that's gonna, you know, mimic adenosine in the CNS. That'd be a great idea.
I appreciate it. Thank you.